Young cancer survivors and cancer specialists from across the country are gathering in Toronto this morning to talk about ways to fill a big gap in Canada's cancer care system. While rates of diagnosis are going down in many age groups, the incidence of cancer for people aged 15 to 29 is increasing. And although their survival rates are improving, the numbers are still lagging behind survival rates for children and for older adults. Dr. Brent Schachter is a hematologist and oncologist with Cancer Care Manitoba. Michael Lang is a 26-year-old cancer survivor from Calgary. And Frederic Denis is a 29-year-old cancer survivor from Montreal. And I guess, and you just finished your treatments then in January.
Yeah, January 21st.
And when you first started going through the whole journey of cancer, people didn't quite think that there was anything significantly wrong with you, right?
Exactly. Most of the people and doctors I've met told me it probably would be nothing. It's probably nothing. Girls your age have very lumpy breasts. It's normal. Don't worry about it. Don't even think about it before you're 40.
And then when was it that you found out about the diagnosis?
Diagnosis was on May 15th of 2009.
After being told you're probably in an age group where that's not going to happen.
Yeah, exactly.
And Michael, what happened to you?
I thought I had asthma. Basically, for a full year, I went into the doctor.
And by the way, you were a very active person as well, right? Like
yeah.
You did a whole bunch of outdoor stuff and.
Yeah, I was in really good shape. You know, it was the last thing I would have thought of looking at me, or even obviously the doctor didn't think that I would have anything other than asthma. You know, so I tried a bunch of different medications and then finally, a year later, did the chest X-ray and found the grapefruit-sized tumor in the middle of my chest. So it was a shock.
Yeah, well, I guess so. And after that, you went through treatment as well.
Yeah, I did 6 months of chemo and a month and a half of radiation as well. So.
And both of you today are doing pretty well?
Yeah.
You look great.
Thank you.
But this is a story that has repeated itself. Some of the numbers are actually quite surprising in terms of the age group between 15 and 29. And this gap that we referred to in the beginning. So what is it? I mean, there's a number of reasons, potential reasons, things that can be corrected, I guess. But is part of it that you're transferring from pediatric to adult care?
Yeah, that's one of the issues, but there are, in fact, a whole bunch of issues. This is multifactorial. There are, as Frederic indicated and Michael indicated, delays in diagnosis because people this age don't believe that they're going to get into trouble with something like cancer. Once the diagnosis is made, the biology of tumors in this age group is different, and they don't respond as well as patients with childhood cancer or adults with cancer. And that results in the latest study, for example, in lymphoma that was just published 2 days ago, shows a 10% difference in 5-year survival between people in this age group and younger children and teens and adults. So it's a significant problem, and although survival continues to improve in this age group, it's not keeping up. These kids and young adults don't go into clinical trials with the same frequency as children do. That is probably a factor. There are also a lot of psychosocial and emotional issues for these kids. They lack peer support. They have terrific emotional problems. They have economic problems as well.
But it's also an invincible type of generation too, right? You feel that nothing's going to happen to you.
That's exactly right. So often follow-up is not, they don't go for follow-up. There is also, this is during a transition period between pediatric health care and adult health care, and sometimes that transition is not managed very well. So all these things add up.
And you mentioned lymphoma, which is one of the, more common diagnoses in this age group than leukemias, I guess brain cancers and nervous system cancers. After your story, you went one step further. You got involved in a documentary.
Yeah, I think one of the biggest things that I dealt with throughout my cancer journey was feelings of purposelessness, and feelings that cancer was just wasting a year of my life, in sort of my prime. And so one of the ways I tried to engage with it and sort of find some purpose in it was to help others, and we decided to do that through a documentary film about young adults. And so we organized an expedition for a group of...
It's more than just a testimonial. This was in Oregon. This was a big adventure.
It was a big one, yeah. It was 8 days through a desert canyon in the middle of nowhere, Oregon, and it was absolutely gorgeous. And we had cancer survivors from all across Canada come on the trip, and some really powerful stories shared in a really unique way on the river. So we're really excited about the documentary coming out soon. So
It's coming out soon. We'll
In
be following
June,
it. Okay.
yeah.
And given your experience and what went on with people saying, "I'm sure you're fine," what would your message be to people? Well, particularly, I guess they call it the adult and young adult, adolescent, I should say, and young adult group.
Well, just trust your body. I mean, if you're not feeling well or if you feel something is wrong, it's probably true. Maybe it's not, but still it's worth it to have it checked for sure.
Were you angry at all given what happened prior to your diagnosis, or did you not even maybe have time for that?
Well, no, I didn't have time for that. And I was not angry. I mean, they did not do that on purpose, or they're not, sorry, they were not mean to me or rude to me or saying like, you worry for nothing. It was just, I don't know. I was not angry though.
It certainly points at those gaps that, as you mentioned, Doctor, will be following this, and thank you so much. I know you've got a big day ahead with the conference. Thank you, all of you,
Thank
for
you very
coming
much.
in.